This segment of CoastLife is sponsored by Beebe Healthcare.
If you've been a sufferer of chronic non-healing wounds, maybe diabetic wounds, or if you've a cancer patient, radiation therapy can sometimes leave some wounds that are really hard to heal, and it can be so frustrating, so disheartening, and uncomfortable too. I mean, you've got a wound that will not heal. Well, lucky for you, Beebe Healthcare has a program, their hyperbaric oxygen therapy. And it's very complex, very involved, but luckily we know some folks and some doctors that can break down the basics for you and hopefully heal some of those non-healing wounds. So we're going to introduce you to some of the doctors with Beebe Healthcare and their hyperbaric oxygen therapy program.
If you've been suffering from chronic, non-healing wounds, you're not alone. Wounds associated with diabetes can be especially difficult and dangerous to live with. Hyperbaric oxygen therapy could be for you. It's complex, but the results can be life-changing. Dr. Zhang, medical director of Beebe Wound Healing and Hyperbaric Medicine, breaks down what hyperbaric oxygen therapy is.
Hyperbaric oxygen is a medical therapy involved in inhale 100% oxygen on the pressurized chamber or room. By increasing pressure will increase the amount of oxygen dissolved into your blood, which will speed up wound healing and decrease inflammation.
From radiation damage to diabetic ulcers, hyperbaric oxygen therapy treats many types of chronic, non-healing wounds.
In our practice, the most common disease we have a successful treatment for people with diabetic foot ulcer, for people with radiation-induced cystitis, neck or head cancer. After treatment, they have multiple bone necrosis. They need a hyperbaric treatment to help them to fix the problem.
Patients suffering with chronic wounds can feel very defeated and hopeless, as Dr. Zhang has seen cases where patients have gone months with no progress until they're treated in Beebe's hyperbaric chambers.
Certain wound, if you don't get a proper, oxygen treatment, the wound may not have a chance to heal at all. We have cases people came in with wound over 20 years and had dealing with until they found us, we just healed. And we were surprised by the result as well. We are super proud to provide this treatment to the community.
Dr. Zhang isn't the only face you'll see with Beebe's Wound Healing and Hyperbaric Medicine program. Celeste Firstnow, practice manager, is not only experienced in the field, but also extremely passionate about what she does.
I'm a nurse of 40 years. Wound care has always been a passion I found very young. I've been in wound care actually for 32 years, and then hyperbarics became a secondary component in about 25 years ago with it, because they do marry each other very well, wound care and hyperbarics. So I have a lot of time and experience in this field, so enjoy it immensely.
Hyperbaric medicine isn't exactly well known to the general public. With that comes questions and misconceptions with how it works.
There are there's a lot of phone calls I get that, can it cure this, can it cure these? And these are a lot of off-label kinds of things that we don't usually do here. But some of the myths, like we had a patient one time thought that the chamber actually filled up with water. And because of the diving terminology that we use here, it gets people sort of scared. I think the other myth is that they think it's a one and done kind of treatment. So a one and done is unfortunately not the way hyperbaric works. It works just like I say, like taking radiation or an antibiotic. You have to take it repetitively. You have to take it as ordered, and then there is a time frame that you are giving that's part of your care plan that's determined by your diagnosis.
Claustrophobia may be a concern for some patients, but Celeste has a process to help you feel more comfortable and more confident with the treatment.
We do have a process that we help people, like at first if they need to, they can just sit on this stretcher. And sometimes I've had patients come in for 4 or 5 days straight and we build up to that. Some patients take some medication to help them with their anxiety. Sometimes they take it for the first couple of treatments, that works great, and then they get comfortable and then they stop. Some people need it the whole treatment. But very rarely do we have issues with patients. And you know why? Because it's clear. You can move around. You don't have to lay in one certain position. You got a great TV that you can watch, and you can bring music. I even had a patient bring home movies once.
Getting treated with Beebe's hyperbaric oxygen therapy does usually start with a referral.
And we do usually get our referrals from physicians who know that the diagnoses that we treat here are appropriate. So either through referrals, and if a patient does happen to call and we do triage them, then, and if I find that it is appropriate, I will then call the physician and say, hey, this patient called me up and we are you willing to look at this with us? So we will work with the patients on those if they're valid, real diagnoses that we feel we could help them here with.
You may also have questions about insurance. Celeste has some answers.
Insurance obviously is important because this is an expensive treatment, and it is something that's done for a minimum of 30 treatments for every patient, usually. And that's 90% of the cases. And then for certain diagnoses, we go to 40. So what we do is we have Medicare, and of course, they will cover the diagnosis. We have to know what those diagnoses are that they cover. Private insurance, we do check to see. We'll call their insurance and then verify that this is a covered benefit before anybody's put in here, and what or any deductibles or authorizations are required, we will let them know before they would start treatment.
I mean, those chambers, they're so cool.
They're so cool.
And
I love that
feel
you went in.
Yes, and because I do get a little claustrophobic.
Okay.
I mean, there are definitely some spaces that, like, if you tell me to go in, I'm like, and I know
too.
they said that they do have some patients sometimes that struggle with claustrophobia, but it's a clear tube. You don't feel squished. They will even kind of walk you through the process a time or two to make sure that you're comfortable, so that you can get in there and, again, really see a difference made with those hyperbaric chambers. They're so cool.
And I don't know about you, but if I'm ever feeling a little claustrophobic, knowing when I'm in good hands actually makes the world of difference. It's when you're alone and knowing that they're talking to you.
They're right there.
So helpful.
Yep, Dr. Zhang can talk to you over the phone in there.
Yes.
You can even watch movies and just, I mean, you can just go to sleep.
I love that.
2 hours later, they'll wake you up and off you go.
And it's healing you. How incredible.
Yes.
Yeah, that's great.
So definitely worth checking out and talking to your doctor if that sounds like something that you could really benefit from and hopefully, you know, really change something for you.
Yeah, definitely. Change your life.
Yes.
Yeah.
But when we get back, we're going to take a quick break, but when we get back, we are headed to spill a little drama, spill a little tea, drink a little tea. All of that is on the way.